Why one should do renal transplant when someone has grown or developed end-stage renal disease? Dialysis dependent ESRD, they should have some sort of KRT, kidney replacement therapy, and then transplant is the good in chronic or long-term KRT care because the it has higher survival benefit, 20 to 30 years even longer by a single transplant, and two or three transplants said to carry the child to and 20, 60 years or so, even longer. And the cost of transplant is relatively low compared to its dialysis counterpart, 5 to 7 lakh in BDT. We convert it into the international dollar, 127 per taka per for $1, and then your cost of the dialysis is expensive. The two sessions minimum in the early stage of the disease is cost around how much? 70 to 80,000 taka per month. Frequent hospitalization, travel, and the exhaustion, familiar, psychological, and frequent complications of the hemodialysis and the disease is a troublesome issue. And if you take the three sessions, the cost will go above 1 lakh per month, which is beyond the reach of the many people throughout the low and low middle income countries. Thereby, the transplant one time business, one time contribution can keep a patient for longer time remission, and the mortality of the outcome. Someone doing dialysis usually in the low and low middle income countries survive on an average 6 years. Someone on the transplant, he survives, as I said earlier, 2 to 3 decades for one kidney, and if second time with second transplant he can have 60, 50 or so. Third transplant can be more, and the cost of dialysis is unaffordable, and the maintenance cost of transplant in the first 6 months of life, it is how much? 20,000, 30,000 highest, and then and maintenance cost of the post-transplant care afterwards, it is how much? It is 5 to 10,000, not more than 15,000, which is affordable by may not be by individual per se, maybe by social contribution or some other means. It is possible. So quality of life there is different. A transplant patient can walk little bit, can do many things, and then little bit of this near normal life. But dialysis patient do not have that sort of quality of life. They are almost a sick person, the extended sort of things, life with the dialysis. So treatment of this end-stage renal disease, dialyzable ESRD 5 and dialyzable ESRD 5, so that should have the transplant. So message is you advocate each and every ESRD, dialyzable ESRD should have to take a transplant, and network of the donors in this country is quite good, and it should be extended. People should understand why one should give. If one gives kidney, the other kidney functions well in good amount of time. More than now, majority of patients do not have any renal failure, so people should know it, so that they feel encouraged to donate the kidney. An extended donor criteria network law should be passed in the parliament, and then people should know it, people should take it. So the resource poor countries like us and many other low and low middle income countries, they should encourage their people to have the transplant, and then your library related and your cadaveric transplant, both are possible. And in the West they do mostly cadaveric transplant. Life related is also being done over there, and near normal life, almost good amount of time they can walk little bit. In Bangladesh, our fastest child who had undergone the kidney transplant in 2026, how much? Now it is about 18 years. He married, he has 2 kids and happily living with them, and he is doing his running a small business in the North Bengal, in the remote villages. So it is not the money, it is the knowledge, it is the motivation, it is the desire, and it is the ventilation of knowledge between us to the people.